Uh, okay. Well, hello everybody, and I am so excited here to have this famous expert on lymphedema and expert educator on it, Jennifer Heit, and she's with Tactile Medical, and we're gonna just go through an overview of lymphatics and how it works.
All right. Thank you, Dr. Wright, for having me. I'm sure everybody here already knows Dr. Wright. My background is as a certified lymphedema therapist. I'm a physical therapist. And like Dr. Wright said, I work for Tactile Medical. I'm now doing a lot of education. So we're going to do an overview of the lymphatic system for all of you today. And you can see here this diagram on the left side of the lymphatic system. It spans our entire body. So in this diagram, what you're looking at, you can see the veins, the arteries, the heart, but in the green there, you can see lymphatic vessels and lymph nodes. We have somewhere in the range of 600 to 800 lymph nodes throughout the body. You can certainly see that there are areas where we have more lymph nodes than others. And what's moving throughout this lymphatic system is lymph fluid. So this is this clear to white fluid. It's composed of protein, fat, water, and waste products or cellular debris. So it really plays an important role in fluid balance throughout the body, as well as our immunity. Do you have anything to add to that, Dr. Wright?
Well, so there's several points I'd like to make. One is everybody learns about, the arterial venous circulation in school. And there's in this diagram, can you see my pointer? But basically, you can see the blood, the heart pumps the blood through the arteries and then it circulates to the veins. And but there's so everybody understands that, but they don't understand that also at that cellular level is where the lymph is created, and each of the all the cells of the body are basically creating lymph, and so it's constantly being produced, and it's this larger, like you explained, the larger protein filled, cellular filled material that then is created, really every heartbeat.
And how I always usually like to explain it, exactly like you said, is that, as we have our blood moving through our arteries, just the pressure from that blood in the arteries is going to push that fluid out. And we call it into the interstitial space. So sort of that space in between tissues. And so you can probably see my pointer here. When that fluid moves out into that interstitial space, you can see those lymph capillaries kind of interspersed throughout that interstitial tissue. Once that fluid is in that tissue, the lymphatic system is responsible for taking up that fluid. So, like I said before, this is not just water sitting in the tissues, it's that protein-rich fluid. And so that's why it's really important for the lymphatic system to be functioning well, to be able to pick up that fluid, because otherwise it's going to cause issues in the tissue. And we'll talk more about that coming up. So I'm going to move forward here.
Perfect.
And this is what I was just talking about. What you're seeing on the screen here, I'm going to play a video in just a second. This is a lymphatic capillary. This is where that fluid is going to first enter the lymphatic system. So if we have something like a buildup of fluid causing excess pressure in that interstitial space, or if we potentially apply external pressure, like if we're doing hands-on manual lymph drainage, or potentially somebody is wearing compression garments, for example, that can help open up these lymphatic capillaries and let fluid into the lymphatic system. So let me press play here. So you can see that fluid going into the lymphatic capillary, and now it's going to go deeper into the body. Here are lymph collectors. These have valves. This is going to keep the fluid moving in one direction. And so now you're eventually going to see it get to a lymph node. So really important for these lymphatic vessels to be functioning properly so that that fluid can move through the lymphatic system and be picked up from the interstitial space.
Yeah, that, wait, can we hold on that? That's super cool to see that. I mean, to see it in live action. And we've really, I mean, this has really just been, I mean, this is cutting edge, because we really have understood this just in the last decade, really, that we understand and now in those lymph collectors, as you've seen, that's a lymphangion kind of pulsing around, and that is sort of so you think of the heart. Well, this is the lymphangion is the the muscle part, and it's at the other end. It's little tiny muscles around these lymph collector vessels that's propelling it along. So
yeah, I'm really glad that you pointed that out, because those lymph collectors are something that we can affect as well. So with things like exercising or doing hands-on manual lymph drainage or diaphragmatic breathing or a patient using pneumatic compression, there are a lot of things that we can do to affect sort of the contraction of these lymph collectors. It's another thing that we can do to help propel that fluid along and to help, improve sort of the efficiency of our lymphatic system. So that's really important. And you also mentioned sort of this being cutting edge. What I think you were trying to say is that whenever we have that excess fluid in the interstitium, it was in 2010 that we actually sort of revised this principle that said previously we thought that when there was all this fluid in the interstitium, we thought that the vein reabsorbed a lot of that fluid and the lymphatic system only absorbed a portion of it. Now we know that when there's excess fluid in the interstitium, that the lymphatic system is responsible for all of that excess fluid. And so that's another reason it's so important to have that lymphatic system functioning optimally. And then, so we saw it moving through those lymphatic capillaries, collectors, through the lymph node. And so ultimately, that lymph fluid is going to end up back at the heart. And so it's going to do so via either the right lymphatic duct or the thoracic duct. And so you can see in this diagram here, that purple portion, so the right upper quadrant of the body, the fluid in that area is going to go to the right lymphatic duct, to that right subclavian vein, and then back to the heart, so back into our blood circulation. And then everything that you see here in yellow, so the lower half of the body and that left upper quadrant, all of that is going to go to the thoracic duct, back to the heart. So that's where that fluid is going. Do you have anything to add to that, Dr. Wright?
Well, yeah, I mean, there's so much. So I do want to talk about is there another slide about all the stuff in the lymph, all the proteins in the lymph? Yes. Yeah.
This slide?
Yeah.
So,
I mean, yeah,
go ahead.
No. Well, no, this is perfect. So you guys saw that it's going back, that where it needs to go, but this is now, if it doesn't, what happens if it sits there?
So if we have that fluid that, is sitting in the interstitial space, I mentioned earlier, of course, it becomes an issue because it's protein-rich fluid. And so when we have that protein-rich fluid, Dr. Wright, you were explaining this to me really great earlier, kind of on a more scientific level. So certainly chime in after I'm finished. But really, when we have that protein-rich fluid sitting there, it causes this chronic inflammation in that area. When there's that chronic inflammation, it starts to sort of invite in these immune cells that are kind of trying to fight this inflammation.
Yeah.
And that's when we get this progressive fibrosis. So that's when we start to see these patients with tissue that starts to feel really hardened in that area. And also because of this chronic inflammation, these patients potentially start to see recurrent infections. Particularly, we see cellulitis in patients with lymphedema. That's something that we can avoid in these patients if that lymphedema is properly treated. So anything that you would add to this?
Well, yeah. So those proteins, I want to put a couple names to them. They're
Yes,
the
thank you.
interleukins. Interleukin 6 is one of the and others, and other cytokines. And so those those are they obviously are part of the immune system, and they're also growth factors. So I mean, I sometimes I like to tell my patients, like if you let this stuff stew on you, it's basically like putting Miracle Grow on these so it's going to grow fibrosis. It's going to the fat content in the areas where where the lymph is poorly drained are going to grow, and all that is going to it's going to spiral, because that's going to put more pressure as that tissue expands. It's going to put more pressure on the venous and lymphatic structures. So it's so important to get ahead of it and get that lymph flowing out of there.
Exactly like you said, it's so important to get ahead of it, because when these patients start to get this fibrotic tissue buildup and that hardening of that tissue, it becomes so much more difficult to manage that lymphedema. Certainly, even if patients are already at this stage where they do have fibrotic tissue buildup in the later, stages of lymphedema, it's not too late to treat. It's just much more manageable, we know, in those earlier stages. And hopefully, if we can get ahead of it, maybe these patients don't even go on to experience a cellulitis infection that can further impair that lymphatic system. So important to catch these patients earlier on. This is just another kind of schematic I put together that looks at how that fibrosis starts when we have lipedema or lymphedema. With lymphedema, we have that high protein edema. With lipedema, that subcutaneous adipose tissue. We have chronic inflammation with both of these. And of course, a lot of patients can have what we call lipolymphedema, where they're in the later stages, and now they sort of have this combination. But we have those immune cells that infiltrate that area that you talked about, Dr. Wright. We have this connective tissue that starts to proliferate in that area, and then that skin progressively hardens. And when that skin is progressively hardening, the lymphatic system is becoming further damaged, makes it much more difficult for fluid to move freely through that area and out of that affected area. Because when we're treating lymphedema, what we're doing is, in part, especially with hands-on manual lymph drainage, or when patients are using a pneumatic compression device, is trying to move that fluid away from the affected area to an area with a healthy lymphatic system that can help to absorb, to drain that fluid. When there's a lot of fibrotic tissue, it doesn't move through quite as well. So really helpful to get that fibrotic tissue softened through lymphedema therapy.
So I want to chime in. So first off, we've been talking a lot about lymphedema, but really this also applies completely to lipedema. So, Shelley Crescenzi just had some nice publications. Rasmussen has some nice publications that show that there's impairment in lymphatic function in really the majority. So most women with lipedema also have some impairment of lymphatic function. We do lymphoscinograms here, and we can see these dilated, tortuous lymphatic vessels that take longer to get the lymph from the foot to the groin. So every bit of this also applies, is completely applicable to lipedema. Now, like your slide shows, it is, sort of the start is different, because in the lymphedema, it's more it's throughout the whole skin, whereas in lipedema, the fibrosis is just in the subcutaneous part, at least early on, until hopefully doesn't progress, but it can progress to the full thickness. And so there is that impairment in lymphatics with lipedema. And then as this goes on, when the tissue grows, of course, if it's a more primary lipedema, we get more adipose expansion than we do in the fibrotic cells, but then they catch up, and so if we want to get that again earlier, like you said, Jennifer.
Yeah, absolutely applicable to both lymphedema and lipedema. So thank you so much for adding that important piece. And this is the last slide I have here. This is just showing again that spiral. When we get those overloaded lymphatics, we have this protein-rich fluid with this compromised immune response. Potentially this patient gets a skin infection, cellulitis, this fibrotic tissue buildup. If patient goes through this spiral with this lymphedema untreated, potentially they could get to the point where they have these recurrent infections with these open ulcerations. And this is, of course, more advanced. But this really shows why it's so important to catch this early on for patients with lymphedema and lipedema, because we can avoid this progressive spiral. And especially for these patients, we know that these conditions are chronic and progressive. And so ideally with treatment, especially catching these patients early on, they will not progress to those later stages. Again, it's much more difficult to manage, not impossible, but it is going to be an impact on quality of life for patients. So very important to catch early on.
Well said. I'm just gonna echo, again, I see this in my advanced stage lipedema ladies that do go on to this, but I feel like we're identifying this earlier. We're treating this more aggressively. I feel like this is tragic when it does go on to this, but unfortunately it still does. But I think if we can be better about things, we should be able to treat this before, with the compression, with the pumps, with the proper care. We should be able to treat this before the lymphatics are compromised to the point that we're getting infections. We're getting fibrosis and mobility problems to the point that then it just spirals out of control.
Absolutely. Yeah. And I mean, it's certainly getting better, especially with clinician recognition of these conditions.
Right.
Still work to be done.
Yeah.
And, unfortunately, a lot of patients aren't aware of these conditions and sort of wait till it's, they're further along before they seek out an opinion. So a lot of education still to be done to catch these patients early on, but we're hopefully moving in the right direction.
Yeah.
Is there anything else you wanted to add before we wrap this up?
Well, I mean, thank you so much. This is such a good understanding. I think when you can see the pictures, that video, to see the lymphatics working, and now we kind of explain what's in the lymph, and then why this is so important. I think that's really, this has been a great meeting just to share these thoughts.
Yeah, absolutely. Thank you for your expertise as well, and for treating these patients. And so with that, I think we will wrap it up.
Okay. All righty.